I'm Sylvia Azania, and in this video, we will discuss the role of men in assisted reproductive techniques, how to approach it, what they can do to get more involved, and the psychological support for the male partner during fertility treatment. Following an infertility diagnosis for a heterosexual couple, regardless of the underlying cause, the man also goes through a complex range of emotions that might be challenging to handle. Frustration, rage, uncertainty, anxiety. Even their self-esteem can be negatively impacted because fertility has been erroneously associated with a man's sense of virility. Nevertheless, the man tends to be more introverted when undergoing assisted reproduction treatment. They generally feel less need to talk openly about their feelings, but they also frequently adopt this guarded stance in a conscious effort to try not to worry their partner. Additionally, they feel pressured by the expectation that they must always appear strong. All of these factors lead to the man avoiding talking about anything related to fertility treatment. However, this coping strategy can create significant misunderstandings. His partner may see this as him disengaging from the process or having second thoughts about becoming a father. This doesn't have to be this way, and the man surely wants to have a baby as much as she does. These are simply different ways of dealing with it. In this way, it is very important to understand that possibly each member of the couple goes through this situation differently. Therefore, to avoid friction and misunderstandings, there must be good communication between both, and always with respect. And before we continue with the content of this video, I'm going to ask you please that if you are enjoying it, give it a like and subscribe to the channel if you haven't already, as you help us a lot to continue and for all the information we publish to reach more people. The female partner demands a significant portion of the focus when the couple visits a fertility clinic. In general, she will undergo further testing. Furthermore, she will also be the one who has to administer the hormone medication, attend more medical checkups and tests, and even undergo surgery if the reproductive treatment requires it. However, during an assisted reproduction treatment, it is important that both members of the couple feel involved in every single step of the process, since it is a shared project. This is particularly crucial when planning to undergo a fertility treatment involving donor sperm, as the male partner might feel even more displaced. In this regard, to ensure that both parties feel involved in the process, recommendations such as the following can be followed. Go through all stages of the treatment together as far as possible. Attend all appointments and checkups as a couple. Assist the woman with administering the hormone medication. Also look at the pregnancy test results together. And taking care of your relationship. It's important to be together at every step of the treatment, but also to do things that distract you so that you don't always have your mind on the same thing. It's important that the couple keeps doing the things that bring them the most enjoyment. Make the important decisions together. To converse with mutual respect, maintain a fluid conversation with your partner, and reach a decision between the two of you. Talk honestly about all the emotions that reproductive treatment generates in order to understand each other and avoid misunderstandings. Be present, hug each other, have details so that the partner feels supported. Attend specialized couples psychological counseling if it is considered necessary, as many fertility clinics currently provide this service. By doing this, both of you will be able to learn strategies to manage the situation emotionally. This increases the couple's well-being. The relationship can even emerge strengthened from having both felt like participants in the search for their baby. Going through assisted reproduction treatment is hard and complicated for the couple. Many different emotions arise that can be difficult to manage. Furthermore, each member of the couple may deal with the situation differently. This situation can result in misinterpretations and conflicts, making the assistance of a specialist to help manage it extremely valuable. For this specific reason, many assisted reproduction clinics now offer specialized psychological support services that both partners can attend. We would really love to hear about your experience, so I encourage you to share it in the comments section. And in the description below, I'll leave you the link to an article where you can read much more information related to this topic.